Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about our topic for the month, which is, do you need to have surgery in order to correct for strabismus? Now, before I get into answering that question, let's talk about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You have two choices there. You can either click on the schedule a consultation and talk with me direct, or you can fill out a questionnaire and receive some feedback about your vision. Now let's talk about, do you need to have surgery for strabismus, which is an eye turn, or what's the deal there? How can we actually truly treat this? Well, I have some pictures to share with you. These patients have always given us permission to utilize these, so I wouldn't show you otherwise, but this is a little guy that we started working with, and you can tell that he has an eye that's turning out here, and then not too far into treatment, actually, he's looking much better and he's got much better eye alignment. He has an exotropia, which is the eye turning out. Now you can also see an exotropia in this adult patient that we've been working with. And here he is with alignment of his eyes about 4 months into phase 2. And this is an oldie but a goodie. I love to share this little guy's story, but he is an esotropia, and then post-therapy, here he is with alignment of his eyes. So esotropia, exotropia, ESO in, EXO out, hypertropia, which I don't have a picture of, but that's a vertical misalignment of the eyes. Those are all different types of strabismus, including there's a cyclovertical tropia, which is kind of like a rotation of the eye this way or this way. And all of those particular cases are something that are treatable with vision therapy and with photosynthetics or with light therapy. So what we do is we train our patients, kind of train their brains or reprogram their brains to align and use the two eyes together better as a team without needing to do any form of surgical intervention. Here's why. Typically, what we find is that patients who have either surgery for esotropia or exotropia will need to have more than one surgery in their lifetime in order to continually correct the misalignment of the eyes. The problem with surgery is that you are either taking and removing a muscle and putting it into a slightly different position to move the eye and rotate it so that it's not misaligning, or you are taking a section and resecting the muscle, which is taking a section out and then putting it kind of back together. And in a resection or a repositioning type of surgery, again, what you're doing is you're altering a muscle. You're not really telling what the brain to do with that muscle. And at Vision for Life and Success, our number one thing that we're kind of telling our patients, and this is the rule that we live by, is that we need to reprogram the muscles on how to perform by triggering and reprogramming the brain with what to do with them. So it's not about cutting or moving a muscle, it's more about reprogramming the brain to control the alignment of the eyes via the signal it sends to the muscle. We do that using syntonics, and then vision therapy comes alongside, and it's kind of like occupational therapy, physical therapy for the brain and eyes to fully correct and train the brain to align and use the two eyes together as a binocular system. Now, to show you some of the filters that we use for this, let's walk you through filters that are used for misalignment of the eyes laterally first. So this particular filter is used if someone has, can you see the green? It's so lovely. All right, so this is the filter that is utilized for someone who has an esotropia or inward eye turn. This one's pretty dark. I'll have to use my pen light in order to give you a better understanding of what it looks like, because it's dark enough that we probably can't really see it real well. And it's hard here, but it's really kind of like a dark bluish green. This is the filter that's utilized for patients who have an exotropia or an outward eye turn. Now, what about the individual who has, do I have it here? The vertical up and down misalignment of their eyes. I do. Let's take a look at that. So in vertical strabismus, which is a hypertropia, we're going to be using, if you can see that, my pen light's not working too well. It is a really nice kind of like royal blue color. Those are the filters that we use for correcting and training the brain how to kind of correct and align the muscles of the eye, so correcting like a strabismus without requiring a surgery. Now again, it takes more than just the syntonics. It takes syntonics and then reprogramming the brain kind of more mechanically, but the syntonics component of it is electrically reprogramming the muscles via the brain on what to do with alignment of the eye. It is very effective, as I've shown you with some of our pictures of some patients that we are working with, and these are current present day patients that we have, and then this is a patient from several years ago that we worked with. So it is highly effective, and obviously it's not invasive, which is what we like. And at the end of the program, we also like the fact that the person who leaves our program and graduates has the ability to maintain their eye alignment over the course of years without needing to have another surgery. And the reason why they're able to do that is through our maintenance program. So we give them a list of activities to continue to work on even after they've graduated, which helps them to maintain the alignment of their eyes so their eye does not turn strabismic again. And it's really kind of what we call a checkup from the neck up to make sure that the brain is using the two eyes together binocularly well as a team with alignment proper. And it's just designed that you want to do that on a regular basis, kind of like after a person wears braces and they have those removed, they wear a retainer to maintain what's going on with the teeth relationship with one another so that you keep straight and aligned teeth. Similarly, we recommend a maintenance program for straight and aligned eyes and the brain controlling the process of vision more accurately. Now, if you'd like more information, you can contact our clinic if you're local, 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you have one of two options there. You can either click on the schedule a consultation with me, or you can fill out a questionnaire and receive some input back about your vision. If you like the video, pass it on, hit the like button, and if you haven't done so already, please subscribe to our channel so you receive notifications of all of our videos. Thank you.